Do not ignore a round face. It is not a sign of putting on a little weight. If you've been blaming age, genetics, or just not trying hard enough, I need you to stop right here. Because today I'm going to show you 7 critical signs of high cortisol that you can actually see on your body. These are not the everyday signs of stress that most people talk about. These are the signs that go deeper, the ones your body puts on display when cortisol has been elevated too high for too long. Stay with me through all 7 because the last one is a sign most women over 40 completely miss, and it might be the most important conversation you have with your doctor this year. I'm Dr. Rosemarie. I'm a doctor of health psychology, and I'm a cortisol specialist. I have spent over 20 years working with women, and I want to be honest with you before we go any further. Too many women get these signs explained away as just aging, just hormones, just life. But here's what I know. Your body does not lie. It speaks. And these 7 signs are speaking loudly. If you recognize several of these in yourself, ask your doctor whether cortisol should be part of your evaluation. You deserve a real answer, not a brush off. Now, let us get into it. Number 1, a round, puffy face that seems to have appeared out of nowhere is not about what you ate last night or how much water you are retaining. This is sometimes called moon face, and it is one of the most well-recognized signs associated with critically high cortisol levels. A consistently round, full face that was not there before is something doctors will look for specifically when they're investigating conditions involving high cortisol, including a condition called Cushing's syndrome. If you're on corticosteroid medications, those medications can produce the same physical effects as pathologically high cortisol. It is a reason to have a very specific conversation with your physician and ask whether cortisol should be evaluated. Take a photo, start to note whether it's been happening consistently, and bring it up at your next doctor's visit. Download my How to Calm Cortisol Chaos guide in this video's description. Let's go to number 2. This next one surprises many women because it is not something anyone really talks about. There is a name for this. It is called a buffalo hump. It is a visible buildup of fat at the base of the neck and across the upper back. And just like the round face, it happens because cortisol is elevated. And it's moving fat towards the center of the body, the face, the neck, the trunk, while the arms and legs can actually become thinner. A buffalo hump does not typically show up early. It is one of those signs that tends to appear when cortisol has been significantly elevated over a longer period of time. Please bring that to your doctor's attention and be specific. Point to it. Describe when you first noticed it. These details matter in a clinical conversation. Number 3, you have probably seen stretch marks before, but what I'm about to describe is different. And once you know what to look for, you will be able to tell the difference immediately. These marks are called stria, and in lighter skin it often appears purple. In darker skin it may look dark brown, reddish brown, or deep purple instead. And the ones associated with high cortisol are unusually wide. They're deeply colored and different from your skin tone. They tend to show up on the abdomen, the sides of the body, and the thighs. Your skin has a natural elastic quality. Think of it like a rubber band. It's designed to stretch and bounce back. What keeps it that way is a protein called collagen. Collagen is basically your skin's support structure. When cortisol stays high for too long, it breaks that structure down. The skin loses its ability to stretch without tearing. Let's say you've put on some weight, even a little. The skin cannot handle it the way it normally would. Instead of stretching smoothly, it tears underneath the surface, and those tears are what shows up as stretch marks. If you are looking at your abdomen right now and what you see is wide and purple, that is not something to mention casually at your doctor's visit. Stretch marks can feel like a personal and sensitive thing to bring up, but they are clinical information, and the details, the color, the width, where they appeared. They tell a story that your doctor needs to hear. Number 4, easy bruising and skin that feels fragile. Have you been bumping into things and ending up with bruises that are way too big for what caused them? When cortisol has been elevated at a high level over time, it thins the skin and weakens the small blood vessels underneath it. The result is that a minor bump, just the kind that you wouldn't have even thought twice about, now leaves a significant bruise. The skin has lost some of its ability to absorb impact because cortisol has been breaking down the very tissue that makes that possible. Easy bruising is a clue that cortisol has been doing its work over time, breaking down tissue throughout the body, and that same process that thins the skin also affects your muscle, slowing down healing, weakening the body's structural layers. For women over 40, this one is easy to write off as just getting older. And yes, skin does change with age, but there is a difference between gradual change and skin that is becoming noticeably fragile faster than it should. Start documenting when you notice the bruising taking place. Go ahead and take a photo. Write down what caused it and how large it has become. Note how long it takes to fade. See, that kind of specific concrete observation gives your doctor something real to work with. Download my How to Calm Cortisol Chaos guide in this video's description. Number 5, this is the sign that breaks my heart the most because women are told over and over and over again that they just need to try harder, move more, push through. Muscle weakness from high cortisol is not about getting fit. It is about hormone activity, breaking muscle down. You may notice that stairs feel harder than they used to. Have you been noticing that? Maybe getting up from a low chair takes more effort than it should. The weakness tends to show up most in the thighs and the upper arms, not because of pain, but because the muscle itself is diminishing. Cortisol that remains high over time breaks muscle tissue down. The muscle weakness that comes from high cortisol is actual muscle loss, and it shows up in the most functional muscles first, the ones that you use to stand up or to climb or to carry or to move throughout your day. If you've been feeling physically weaker and you cannot explain it through your activity level, a recent illness or something else, that is worth investigating. Let's go to number 6, adult acne and hair thinning. They get blamed on hormones. And technically that's true. When cortisol is elevated, it stimulates pathways in the body that increase oil production in the skin, which can bring on adult acne, even in women who have not had a breakout since they were a teenager. Your hair grows in cycles, and it grows, it rests, and then it sheds. That's completely normal. The problem is that when cortisol stays elevated, it pushes more of your hair follicles into the shedding phase at the same time. Acne and hair thinning on their own have many possible causes, that's true. It could be thyroid issues, it could be other hormonal shifts or nutrition gaps. Cortisol is not always the answer. But when these two things are showing up together and showing up alongside some of the other signs on this list, it's well worth investigating. Download my How to Calm Cortisol Chaos guide in this video's description, and I'm also putting it in the comments. Number 7, slow healing and getting sick too often. If your body is slow to heal and you are sick more often than you should be, your immune system is trying to tell you something. Cuts, scrapes, and minor wounds take longer to heal than they should, and you find yourself getting sick more often than you used to. The problem starts when cortisol stays elevated for too long, and instead of helping your immune system, it begins to suppress it. Tell your doctor you want cortisol evaluated. It's time to get answers. These 7 signs are not about everyday stress. If you recognize yourself in 1, 2, or more, keep watching your body and mention it at your next visit. Bring your observations, bring your photos, bring your questions, and do not leave that office without a real answer. Well, now that you know about 7 critical signs of high cortisol, you can actually see You might be wanting to learn the top 5 foods that lower cortisol naturally and burn fat. But how do you do that? Well, it all starts by watching this video here, because when you pair what you just learned with what's in this video, it's way more powerful. Thank you for watching, and I'll see you in the next video.